My name is Clark Otley. I'm the chair of the Department of Dermatology at Mayo Clinic, and we're here today to talk a little bit about skin cancer in solid organ transplant patients. Solid organ transplant patients receive an allograft or an organ from another patient in order to repair or replace their damaged organ. In order to help that organ survive, they need to be placed on potent immuno-suppressive medications which suppress their immunity against infections and, in some cases, cancer. The most common complication from a cancer perspective of organ transplant medications is skin cancer. In the Department of Dermatology at Mayo Clinic, we see a large number of transplant patients, many of whom do experience skin cancer much earlier in life and in larger numbers than in the typical population. We examine our patients in the transplant center at Mayo Clinic and talk to them about educational practices and prevention of sun damage to minimize the risk of skin cancer. But even with that education, many patients have had a lot of sun damage in the past and do eventually develop skin cancer. For most patients, the skin cancer develops about 5 to 8 years after their organ transplant. The higher dose of transplant medications you're on, for instance, for heart transplant patients, the more likely you are to have skin cancer earlier and in larger numbers. Once people do start to develop skin cancer after a solid organ transplant, it's very important that they have those skin cancers and precancerous lesions treated aggressively so that they don't go on into a more aggressive form of skin cancer. Commonly used treatment modalities for treating precancers include freezing with liquid nitrogen, topical chemotherapy creams, as well as immune-modifying creams. We'll also always strongly recommend sun protection with sunscreens and protective clothing. Once a skin cancer develops, if it's a minor skin cancer, it can often be cured very easily with a simple office procedure called ED&C, or electrodesiccation and curettage, or curettage and cryotherapy. These are essentially scraping and burning techniques which do a great job of taking care of minor skin cancers. If a cancer progresses slightly more, it may require surgery. When it's on the face or the head and neck area, we'll often employ Mohs micrographic surgery to take care of their skin cancers. Mohs surgery is a microscopically controlled surgery where we excise the cancer with local anesthesia and then test it 100% under the microscope to be sure that all the roots are gone. If there are any roots that are left, we'll go back and take another piece and test it again until the cancer's all gone. And then we do a reconstruction either with a straight row of stitches, skin flaps, or skin grafts. It's very important for our transplant patients to follow up regularly with their transplant physicians and dermatologists so that they can have early recognition of skin cancer. Every skin cancer passes through an entirely treatable and curable phase before it will become something dangerous or prone to spread. Occasionally, patients will have large numbers of skin cancers, and it can be very difficult for an individual doctor's office to handle those skin cancers. At Mayo Clinic, we have a team approach where we have a large number of people available to take care of large numbers of skin cancers in severely affected organ transplant patients. In addition, we have a multidisciplinary collaborative approach where we can discuss with doctors from various specialties, including head and neck surgery, oculoplastic surgery, plastic surgery, radiation oncology, medical oncology, and of course our transplant colleagues, about how we may take care of these patients in terms of altering their immunosuppressant regimen so that the risk of skin cancer is lowered. If there happens that there is a spread of a cancer, we work in a multidisciplinary fashion with our colleagues in head and neck surgery, general surgery, radiation oncology, and medical oncology to give multidisciplinary care so that we offer the highest degree of cure rates for those severe skin cancers. Also, we occasionally will place people on chemopreventive or cancer-preventing medicines to lower their risk of skin cancers. All of these strategies have different pros and cons, risks and benefits, and we consider all these issues in a team perspective to give the best care to our patients. We have a lot of experience at Mayo Clinic in the Department of Dermatology caring for organ transplant patients with skin cancer, and we'd be delighted to help anybody out who needs it.